Welcome to the Lyster Health Talks podcast. Each month, listen in as the team focuses their discussion on relevant, relatable health content that empowers your health and the readiness of the force. In today's episode, we're exploring the roles of the patient advocate. As your representative, they assist you or members of your family with many aspects of your medical care. Let's join the team as they dive into patient advocacy.
Hello, Fort Novacell, and welcome back to this month's episode of Lyster Health Talks. I'm joined by returning guest, Lieutenant Colonel Gina Thorpe, our Deputy Commander of Nursing, and patient advocate, Miss Lacey Groves.
Hello.
Happy to be here.
Welcome, ladies. This month's episode, we're going to talk a little bit about our patient advocacy and how they can help our service members, family members, and retirees navigate the health system. For those serving in the military or those that have served in the military, navigating the health system can be complex. Between duty station changes, dry care options, and access to specialty care services, service members, retirees, and their families face unique challenges that civilian patients may never encounter. That is where our patient advocate can really help you navigate the system, especially during PCS. Lyster is a lot smaller, so it's easier to navigate, and the patient advocate is very easy to access. But Lacey, do you want to tell us a little bit about what you do and how you can help patients in their journey?
As a patient advocate, I get to be the liaison between the patient and Lyster. So anytime patients need help navigating their patient care, anything within the clinic, anything that they have a question about, they can walk into my office, they can email me, they can call me. If they have any kind of question that they need help navigating their health care and what is going on within Lyster. I receive Ask comments, and that is where a patient can go in and leave a comment after their recent visit and leave their comments about their visit. Lots of times we get great feedback about the providers here or someone that helped them while they were here. And those are all passed along to the chief and to the deputies and to command, letting them know how effective our staff are. And then also people leave all kinds of comments so that they can be addressed.
A lot of people have said that we don't read ICE comments. Can you explain that a little bit more?
Oh, definitely. We definitely read the ICE comments. I'm the first line on that. I read every ICE comment that comes in. I try to address them every day. As they're coming into my email, I'm checking them and I'm forwarding them to the chief and the deputy. So every ICE comment is definitely read, it is definitely heard, and there are always things moving because of those ICE comments that are made.
Now, Ms. Groves, I know you mentioned that you absolutely are here to assist patients, but oftentimes when you come into a healthcare system and clinic, it can be very confusing how to just in general navigate the clinic or get to the right location. Will you help patients navigate talking with the clinics or providers, or if they have questions with the providers, or should an issue arise or they have a concern?
Definitely. Anybody that they could just walk right into my office, I can take their concerns, I can reach out to the provider for them, and then I can contact them back. There's lots of different scenarios, but I could definitely help each patient if it's not just to be a listening ear when they come in.
What is the best way of getting in contact with you?
So they can walk right in and see me. My office is right beside the coffee shop when you walk in Lyster. They can find my phone number on the Lyster webpage. Also on the Lyster webpage, there is an email address. They can click on that link and it will go straight to email me, or they can give me a call at 334-255-7229.
Now, Ms. Groves, luckily in the military system, our system sometimes is easier to navigate, and we do have a lot of advantages being in the military health system. And I know some of the benefits of your role in helping our patients is that if they do have questions, that you can help them navigate our TRICARE system or get them to the right person within our clinic, which I think is very important, as well as having you can help educate some of our beneficiaries on some of their coverage plans, as well as help get them to the right person to help resolve any denied claims, which in our clinic is generally our referral management office, but at larger clinics, sometimes it is the patient advocate as well. But ultimately, you are one of the main people in our clinic that can help get them to the right place, either help them navigate the system within Fort Novacell, as well as explain their rights as a patient.
Yes, ma'am. Yes, I'm always an open door, and we have a great managed care department, and they are awesome at answering patient questions as well as mine, because they answer a lot of my questions as well.
One of your key roles is to improve the overall overall patient experience.
I definitely love hearing from patients and helping them navigate. I'm a great listener, so I love to listen to them and try to figure out the best path for them to go to get those problems, fixed and help address any concerns that they may have.
In my career, there have been countless stories about patient advocates helping folks navigate systems where a patient advocate has been able to intervene and get patients to the right person that can typically expedite care or often catch something that maybe wasn't known, such as expediting a medication refill or helping somebody that needs a referral expedited or helping a new Army spouse that doesn't know the system whose husband is deployed to get to that care quickly and ultimately help them and enhance their care experience. The importance of your role cannot be understated. The biggest thing is that I would like patients to know as the commander is utilize you. We strive at Lyster to have the best patient experience possible, and one of the tools is the role of the patient advocate that can help. Another role you have, Lacey, is a member of the Patient Family Partnership Council, which is an excellent program that we have here at Lyster. Colonel Thorpe, will you talk a little bit about that program for us?
Absolutely. So the Patient Family Partnership Council, or PFPC, which is definitely a mouthful if you're trying to say it 3 times fast, is kind of an advisement council that allows family members to advise both the commander, you, Colonel Steder, and the rest of our team here at Lyster on kind of the best way to deliver care. And so kind of it's an advisement board, and so we do meet quarterly. We would love to have a little bit more attendance, and I think that would really allow people to have a voice and let their insight be heard. And so that way we can really ensure that we're delivering the best patient care experience for all those that cross through our doors. That's
excellent. How, if somebody wanted to join or be a part of that council, how would they join?
Before it was quite cumbersome to be a member of the PFPC. Those that wanted to be on the committee had to go through the whole Red Cross volunteer screening, including a security background. It was very cumbersome, and so I think that's why the participation wasn't as strong as we'd like it to see. Now it has been a lot more streamlined, and so those that are interested in this opportunity, all they have to do is come in, past a coffee shop, make a little left, and come in and see Miss Groves in her office, and just express that interest. It'll require a couple forms that need to be signed. They'll have to do some HIPAA training. Obviously, a commitment to attending our quarterly meetings when possible. But other than that, that's all we're asking for.
Gina, can anyone join?
So I would say overall, we are looking for those family members and retirees. We do have other venues for the service members to voice their concerns. However, if they like service members, we can open that as an opportunity.
No, I think that's great. I absolutely hope more people will join. I think it's very useful to get input from some of the people that actually use our system outside of just the military. I know at some of my meetings that I do get a chance to talk to some of the senior spouses. They have a lot of good insight. For instance, I got a recommendation to do school physicals before PCS season because oftentimes families are PCSing well after when most MTFs do physicals. So it'd be easier for them if we could do physicals close to the end of school. And that's something that I would have never even thought about. So it would help us enhance patients' experience if we had family members or retirees that are giving some feedback on how we can make care better for you.
Absolutely. And I think the one thing just to kind of set the experience, if someone does want to join the Patient Family Partnership Council, just know when you do attend these meetings, what we do is we have representatives from every section throughout Lyster. So all what we call our chiefs, sometimes they're into ICs, are here representing their sections. And so if the patient says, hey, they mention the school physicals, or hey, I'm having trouble with these immunization forms, we usually have that subject matter expert there at the committee to help address those concerns and ensure that we get that rectified as soon as possible.
Thank you very much, Gina. Ultimately, to kind of wrap up this podcast, our goal at Lyster ultimately is always to ensure that our patients receive the right care at the right time in the right way. And with Lacey and our patient advocacy program and the Patient Family Partnership Council, those are 2 tools that we have to help assist that. But before we wrap up, I just wanted to see if you ladies have any final thoughts or any antidotes to leave our audience with.
So one thing I would add, ma'am, as we're closing up is I think it's really important. I love ICE comments because I always think that feedback is a gift. But I would always advise people when they're leaving ICE comments, please leave your name and contact information. Like Ms. Gross said, we do read every single ICE comment, and it's a lot easier to address those concerns or call you up or explain, hey, our voicemail is down. But if we don't have that contact information to kind of have that conversation, then we can't fully close that feedback loop. So that's my.
And as far as the patient advocate goes, I'm super excited and my door is always open. So please come by and see me. I'll be happy to help you navigate any situations that you have.
Thank you for joining us today, Fort Novacell. And just remember, your voice matters to us. We want to provide the best care that we can to all of you. And until next time, our care keeps them in the air.
The Lyster Health Talks podcast is produced by the Lyster Army Health Clinic Public Affairs Office at Fort Novacell. You can catch all of our episodes on your favorite streaming platforms. Stay healthy, Fort Novacell.